Okay, doctors, we're here today to talk about an innovative treatment called Photodynamic Therapy Plus, or PDT Plus, non-toxic in its scope. And I'm honored to be here with Dr. Quintana, who's a veteran in complementary medicine, starting in the early 1990s, and part of the Hope4Cancer medical team since 2009. So thank you for being here. And Dr. Salinas, all your work in admissions, in the home program support, and as one of the staff doctors at Hope4Cancer. So what is PDT Plus?
Well, photodynamic therapy stands photo for light. So we're going to be stimulating different functions of the cells and different sensitizers with light, low laser therapy light.
Okay, and that's what's unique about PDT Plus, because since 2001, Hope4Cancer has been doing sonophotodynamic therapy. So now with PDT Plus, we're taking the photo or the light part of that to another level. And we're using low-level lasers that are not cutting lasers, they're not harmful lasers, they're not going to burn your skin or anything like that. So one of the benefits of PDT Plus is using light that is administered and applied in different modes. For example, intravenously.
Intraarticular.
Or interstitial also.
What does interstitial mean?
Interstitial is the application of this therapy into tumor.
Okay.
The tumor, basically it could be internal tumor, but also external tumor. Breast, neck, for example.
That's very good, because now we could target the tumor selectively with the photodynamic therapy. And
something important there is that there's a limitation with light penetration, but with the special catheters that we have with fiber optics, we can go in deep as 12 centimeters. So we can, irradiate the peritoneum, for example, in a peritoneal carcinomatosis. We can irradiate a breast or a lymph node in the underarm.
Mm-hmm. We did a procedure with treating a tumor in the bladder and the prostate,
exactly,
right?
Yeah. There is a specific way to do it with a bladder catheter, and the fiber optic intruded inside and can be treated with different ways. It can be treated the bladder, but also the prostate. So we can do these two organs in this way with the laser therapy. And very specific and very accurate.
Right, exactly. Very targeted, very accurate. So the benefit of this is that we can choose from different sensitizers, different natural substances that are uptaken in a slightly different way and require different wavelengths or colors of light. Let's talk about the curcumin, for example.
The curcumin, it gets activated by blue light, and it helps in activating fibroblasts, so the healing process gets accelerated. Also enhances nitric oxide, enhances an anti-inflammatory effect on the patient, and activates the telomerase activity, meaning that it has an anti-aging benefit.
Excellent. So that's the blue light.
Blue light.
With curcumin.
With curcumin.
Red light, for example, it increases the microcirculation, which is the perfusion of the cells, and the regeneration of the tissue is very important.
Okay. So we talked about blue light, we talked a little bit about red light, because there's many benefits of all these lights. And the other sensitizer that we use is hypericin, and we use the yellow light with.
Yellow light.
Yellow light.
The yellow light is important in the metabolism of vitamin D and serotonin. Vitamin D is very important for immune system function, for bone health or calcium metabolism, and serotonin is really important for the emotional state of the patient, which also affects the immune system.
The happy hormone, right?
Yeah, the happy hormone.
Most cancer patients tend to be depressed or down because of that C word. So when we're using hypericin with the yellow light, we're even elevating the mood. And so we're talking about other effects that are not related to cancer, and these are the additional benefits of PDT plus, which is we know the effect on cancer cells because PDT plus generates reactive oxygen species and causes cancer cell death through apoptosis and or necrosis. Also, it activates the immune system and it decreases the blood supply or stops the blood supplies to tumors. So the third effect of the PDT on the cancer side is decreasing the blood flow, the angiogenesis part. And what we were just describing is all the other beautiful effects that we get with red light, blue light, yellow light, ultraviolet light, infrared light, and near-infrared light. So we have a diverse spectrum, sort of like the rainbow, right?
Yes,
God made the rainbow for a reason. Light is healing, and so we're using sound and we're using light to affect the cancer process, but also to get a lot of additional benefits. What other benefits come to mind off the top of your head from photodynamic therapy plus?
It can increase the wound healing with one specific range of light. It could improve all the immune system, lymphocytes, dendritic cells, macrophage. It improves the circulation, improves the
concentration of oxygen gets boosted, so we deliver better oxygenation to all the tissues and also to tumors, which will be translated into reactive oxygen species. We improve the melatonin production, which it's very important in the sleep-wake cycles, which has a very important function into immune system. And melatonin is very important also in the pineal gland for detoxing our central nervous system. I mean, it has many benefits.
So, doctor, I'm here at the clinic. I don't have cancer. I'm here with my companion. Can PDT plus help me?
PDT has another application besides cancer. It can be applied in aesthetic things, as in a dentist. They can use it also specific light as an antiseptic.
Okay, so
for
when
infections.
There's infections, right?
It can be done for infections. It has different applications.
Red light increases, for example, peroxidation of fatty acids, so we can lower cholesterol in the bloodstream with red light. We increase the metabolism in the mitochondria, so the energy production improves. So if a companion is feeling weak or without energy, and we deliver red light, we will improve the respiratory chain in the mitochondria, and that will boost his energy a lot.
I felt that too, because I've done PDT plus for myself, and I felt more energetic. I felt like I could breathe deeper. It really helped my oxygenation. I felt that right away.
We are talking here about cancer, but also PDT plus or laser therapy can be applied in a different medical situation, like people with diabetes, strokes, people with problems with Parkinson or Alzheimer's. They have so many different wide applications of the laser therapy.
And the importance of that is that cancer patients can present an array of different other pathologies, including Parkinson's, diabetes, arthritis, or joint pain. And so the benefit of PDT plus to improving the quality of life as we're using it as a cancer therapy is quite unique. And that's why I started off this discussion saying that it's quite an innovative therapy that we use at Hope4Cancer Treatment Centers. What about tolerance and side effects? What have you seen?
It's very well tolerated. Mm-hmm. The only precaution people need to do is just to be away from the sun when we use the hyperzine specifically. But it's something that people can take very easily, very well.
And another thing that comes to mind is, can this be a long-term therapy? Because at the clinic, we're using the PDT plus intravenously or interstitially directly into a tumor, an external tumor or a more internal tumor. And so the way we do that is that we provide a laser watch, right? A laser watch and oral sensitizers for the patients. So they take the oral sensitizers every day, by mouth, obviously, and they wear the laser light on each wrist for 1 hour each a day, so 2 hours a day. And the beauty of this is that On the inner wrist, the skin is really thin. We have good blood supply there. And so the photons of these lights, these laser lights, are going to go and distribute it throughout the body and then focus on the cancer area. So quite exciting how patients can very easily continue photodynamic therapy plus at home.
Exactly.
And then also with the laser watch, they're getting these additional benefits of energy, mitochondria, increasing nitric oxide. And we see that patients who are on PDT plus therapy and they have comorbidities in addition to cancer like diabetes and other things, those conditions improve significantly also. So the other option, Dr. Salinas, is for patients to potentially come back after their initial 3-week stay at the clinic.
Of course, during the first 3 weeks that they stay at the clinic, we do IV therapies, which is, let's say, way more intense than the watch, and then they go home and then maintain their therapy in a maintenance dosage with the watch and the sensitizers. But then if they come every 3-4 months, for example, we can boost even more the immune system, and we can have more of those benefits in a way higher intensity. So if we do those 3-4 sessions of boosting throughout 1 year, I mean, the benefits are way more than just with the watch.
So they come to the clinic for 3 weeks. They go home with the laser watch and the oral sensitizers, and then they could come back periodically for booster sessions of PDT plus. That's a beautiful program. And let's wrap this up with talking about the science, right? Because it's quite an innovative therapy. We know that sonotherapy and phototherapy has a lot of science behind it. There's been in vitro study, animal study, and patient outcome studies. And so we're accumulating this data. PDT Plus is a therapy that is easy to do at home. It's initially for the 3 weeks, and patients come back for follow-up, and they could do booster treatments subsequently. It's a safe therapy, and I'd just like to thank you both for this discussion.
You're welcome.
You're welcome, Doctor.